Hi everyone. Today we are going to see about non-stress test. It is one of the common things which again is been asked in USMLE. So let's go into its detail. What is a non-stress test? Non-stress test is nothing but we will be detecting there is a graph which is to find the uterine contraction as well as the fetal heart rate. So in that graph there will be a correlation, both uterine contraction as well as the fetal heart rate will be monitored simultaneously so as to find the relation between uterine contraction and fetal heart rate. Say for example, so uterine contraction measured in this and heart rate will be measured. So the relation between the uterine contraction so this relation will give a lot of we can find a lot of what is happening inside. Fine. So first let's proceed to early deceleration. What is an early deceleration? Early deceleration means, deceleration is the term where we say that the heart rate decreases or it drops, but early coincides with the uterus. So when there is a uterine contraction and there is a deceleration immediately after the uterine contraction, that is, it coincides almost immediately. So here we are having a uterine contraction and here the baseline heart rate along with the uterine contraction. When we are having the decrease in the fetal heart rate, this is known as the early deceleration. Early deceleration is generally benign. We need not worry much because this is a normal physiological response. Say for example, there is the uterus contracts. So during contraction what happens? The fetal head is being pushed into the birth canal. When it has been pushed lower inside, there is compression of the skull bones as well as the facial bones, which will result in the vagus nerve activation. Because of the vagus nerve being active, the fetal heart rate decreases. This is the early deceleration and it is normal, nothing to worry about if we see this in the graph. The next one which we need to worry about is late deceleration. What is a late deceleration? As the name says, there is a deceleration, that is, there is a decrease in the fetal heart rate but bit late. Say for example, this is a uterine contraction, fine, and here there is a normal baseline, but it doesn't happen immediately during the contraction. It happens a bit late, like after uterine contraction, after a while there is a dip of the fetal heart rate. So this particularly we need to be quite careful if we see this in the patient, that is late deceleration. Why? Because when there's a day, what does this mean? If you see the pathophysiology, there is a uterus contraction, right? After a while, when the uterus has been after contraction, there is a dip in the heart rate. What does it mean? That means the fetus is not getting enough adequate oxygen through the placenta. After a while, after some time the uterus has been contracted. Why should this happen? This happens because of uteroplacental insufficiency. The uterus contracts and after a while there is a placental insufficiency. That uteroplacental insufficiency can happen because of 4 main categorical reasons. So like it can happen because of maternal reasons, it can happen because of the placental reasons, and it can happen because of the fetus per se, or it can happen also because of the oxytocin. Okay, so you can think of all the conditions which will compromise the oxygen supply to the fetus. Say for example, in maternal, it can be because of diabetes mellitus, it can be because of hypertension, it can be because of diabetes mellitus, it can be because of hypertension, or it can be because of eclampsia, and or else it can be because of maternal hypoxia, anything. It can be because of any reason, maternal factors. Similarly, placental insufficiency, it can be because of abruptio placenta also. Fetus, if you see, the fetal, it can be because of either, this is insufficiency, right? So already there has to be some problem so that it is not able to withstand the uterine contraction. It can be because of fetal anemia, it can be because of fetal growth retardation, and also, or it can be even because of fetal heart defect, and for some patients where there is a placental, already there is a placental insufficiency, on top of it if we give oxytocin, then that will again impair. So, if we find late deceleration, the best treatment, that is there is a triad, is that we need to stop oxytocin first. And the second thing is we need to first stop the oxytocin, whatever is been administered. Then second thing is we need to position the mother in the left lateral decubitus position, because this is a position which will help to relieve any stress, associated stress. And the third one is we need to give IV fluids, oxygen and IV fluids to the mother. So, in case if this triad does not work, then we need to go for immediate cesarean section. Fine. Okay. Let us go on to the third condition, variable deceleration. Variable deceleration, the name says, it has no relation with the uterine contraction. The uterus will be contracting, the graph will be there, and the deceleration will be, it can be at any point. That is the variable deceleration. Most common cause of variable deceleration is what? So, mostly it is because of umbilical cord compression due to any reason. Umbilical cord compression can be because of the head being compressing the umbilical cord, or sometimes the fetus can hold the umbilical cord, any reason can be. So, even for late deceleration, the best treatment is this triad. That is, we need to stop oxytocin, we need to position the mother, and we need to give oxygen or the IV fluids. Along with it, USMLE asks about one more criteria, that is amnio infusion. What is amnio infusion? As the name says, here we are supposed to give them IV saline into the amniotic fluid. So, when we administer IV into the amniotic fluid, it is believed that it can help to relieve the distension. I mean, it can help to relieve the umbilical cord compression for a while. This can also be tried. Thank you for patiently listening. Have a good day.